Challenges that behavioral health providers, or particularly psychiatric hospitals, have in a rural setting is, first of all, being able to meet the needs of all the referrals that are accepted by an organization like ours. There has been for many years a shortage of acute care beds. Currently in our services, approximately 2/3 of our referrals or needs for adult beds come from the emergency rooms, but unfortunately there are many times when there's just simply not beds available at Royal Oaks Hospital or at other acute care psychiatric facilities in the state. And so those community hospitals are left with trying to determine what they can do to manage those mental health issues on their own. I think probably the biggest challenge that a facility like Royal Oaks Hospital has, which is an acute care psychiatric facility, is meeting the needs of the community. Currently right now, able to admit probably about 40% of the calls that we receive. The other 60%, those patients do meet criteria and do need to be hospitalized, but again, with the shortage of beds, typically cannot take place. Finding staffing for behavioral health facilities is very difficult. When our facility is not located in a metropolitan area, we have to be very creative in ways that we can bring staff to the rural programs, and I have reached out to many of the academic programs in trying to provide training, and what we have experienced is that oftentimes many of those that train in our system will end up staying employed in our system after they finish their training. The challenges for us as a rural facility, many of our patients that are coming in are coming as transfers from emergency rooms. Several of those individuals do not have any kind of third-party payer. We obviously do provide a great deal of uncompensated care in our system. Now, fortunately for our system, we are a partner organization with a community mental health center. The other big challenge for us with patients coming from these smaller rural communities is the lack of services that are available following hospitalization. In many of these our referrals, patients come from the smaller communities where there just simply is not mental health professionals that are living there that can provide services for them following hospitalization. And so we have some unique challenges in trying to arrange services and continue to provide treatment for those individuals.